Health Talks, where we bring awareness and information regarding all health-related topics. Now today we'll be talking about a very interesting and pressing issue, eating disorders. And for today's segment, we have on board myself, Miss Brown, Miss Watts, and Mr. Reed. In today's segment, we have quite a bit to unfold, which includes casual factors, clinical aspects, treatments, obesity, risk, and so on. So grab your notebooks, grab your pencils, grab your pen, and your snacks if you need to. We have quite a bit to explore. See you there. Alright, so as previously mentioned, we will be exploring eating disorders. Now, our primary objective for this segment is focusing on the clinical aspect of eating disorders, and the main types that we have here are anorexia nervosa, bulimia nervosa, and binge-eating disorder. Alright, so what are eating disorders? Because obviously we need to know. So eating disorders are serious and complex mental health conditions that involve disordered eating behaviors, distorted body image, and intense concerns about food, weight, and shape. Now, these behaviors can include restricting food intake, binge eating, purging, or compulsive exercise. Now, it's important to note that they are not just about food. They're often ways of coping with emotional pain, stress, or low self-esteem. Eating disorders can affect anyone, regardless of age, gender, ethnicity, or background. And it's important to note some factors too that might lead to these disorders. So from a biological standpoint, we have genetics. So having a family history of eating disorders, depression, or anxiety increases the risk. Also psychological factors where, low self-esteem and feelings of inadequacy is involved. And if we want to go to the social and cultural factor route, we can say cultural pressure to be thin or fit, and also social media influence, which is very prevalent in this day and age. So those are some causal factors that could lead to eating disorders. Alright, so at this moment, I want to share a poem actually with you all in regards to the different eating disorders that we previously mentioned. And so this poem is titled Feast of Shadows. In the mirror, the war begins. A body becomes a battlefield, a prayer unanswered in glass. Anorexia whispers, less is more. While the DSM-5 lists her symptoms like commandments carved in bone, restriction, fear, distortion, a temple starved in the name of control. Bulimia follows behind, a thief of belief, a cycle of feast and flame. The manual calls it recurrent binge and purge. 2 words clinical enough to hide the ache behind bathroom doors. Teeth erode, heart flutter, but not from love, but from imbalance and loss. The soul counts calories instead of blessings. Then binge eating, the quiet giant of the three, where hunger becomes a flood, not for food but for feeling. DSM-5 notes, no purge, only pain, episodes soak in shame. Statistically, she is the most common. Millions sit in silence with plates heavy as guilt and grief. They say nearly 9% of the world will meet an eating disorder face to face, and every 52 minutes, one will not return from that meeting. Numbers don't cry, but mothers do, friends do, faith does. So prevention begins, not in hospital, but in hearts, in classrooms that teach body gratitude, in sermons that say you are more than flesh, in conversations that replace perfect with possible, because recovery is not a diet, it is restriction. It is faith stitched in the skin of survival, believing that fullness is not failure, that nourishment is worship, and that every scar, visible or hidden, is a psalm that still sings. So eat, not to vanish, but to live, to taste grace again, one honest bite at a time. Alright, so as we officially come to the end of this segment, I just want to leave a thought with you all. So please do understand that there is no disorder that defines who you are. So if during this segment you have highlighted any of the criteria that might relate to you or anyone else, please seek help. Please reach out, because hey, you can overcome. And with that being said, please understand, no body shape can name your worth. You're God's beloved loved here on earth. In every struggle, light breaks through. You're not what you eat, you are who God calls you. So, I hope that you all have been taking your notes, because I did say to get your pens and your pencils and your notebooks, right? So I hope you have learned a lot in this segment. So please stay tuned for our upcoming segment where we'll talk about treatments and obesity. See you there.
Hi guys, my name is Kwanzaa Watts and my topic today is eating disorder. So to understand a little bit more about this complex issue, we have a special guest, Miss Leslie, who will take us through the key points in an animated segment. Hope you guys learn a lot.
Thanks for that intro. Now let's get into the heart of it: how eating disorders are treated, and why obesity isn't just a personal issue, but a global crisis. These are real struggles that affect real people, including right here in Jamaica. Eating disorders like anorexia, bulimia, and binge-eating disorder aren't just about food. They're about pain, control, and how we see ourselves. Someone with anorexia might starve themselves, even when they're dangerously thin. Someone with bulimia might binge eat, then purge to get rid of the food. And binge-eating disorder, that's when someone eats large amounts of food and feels out of control, but doesn't purge. Recovery is tough. Many patients feel conflicted. They want help, but they're afraid of change. Some even have to be hospitalized against their will. Suicide risk? It's real, even after treatment. That's why we need compassion, not judgment. So how do we treat it? For anorexia, the first step is restoring weight to a safe level. That might mean hospitalization or even IV feeding. But physical recovery isn't enough. Without therapy, the weight comes off again. That's where cognitive behavioral therapy, or CBT, comes in. CBT helps people challenge toxic thoughts like, "My only worthy if my slim." It's also the top treatment for bulimia, helping normalize eating patterns and break the binge-purge cycle. CBT teaches people to eat regularly, stop labeling foods as good or bad, and reframe the all-or-nothing thinking that fuels disordered eating. Now that we understand the basics of treatment, let's look at how healing goes deeper into family, mindset, and even spiritual restoration. For teenagers, family therapy, especially the Maudsley model, is powerful. It doesn't blame anyone. Instead, it helps parents support their child's recovery, rebuild trust, and create a healthier home. The therapist guides family meals, helps parents become a support team, and later works on rebuilding relationships. Studies show that family therapy leads to higher recovery rates than individual therapy, especially when the disorder is caught early. But not every treatment works for everyone. Older patients or those with long-standing anorexia may need new approaches. That's why researchers are exploring transdiagnostic treatments, approaches that work across different eating disorders. These therapies focus not just on eating behaviors, but also on perfectionism, low self-esteem, and relationship struggles. And they've shown promise, even when the diagnosis isn't clear-cut. In Jamaica, we need more awareness and access. Many young people suffer in silence, afraid of being judged or misunderstood. We must create safe spaces in schools, churches, and homes where healing is possible. And spiritually, Psalm 139 reminds us, "I am fearfully and wonderfully made." Therapy helps us remember that truth and rewrite the lies we've believed. Healing isn't just physical, it's emotional, mental, and spiritual. Now let's shift our focus to obesity, a different kind of struggle, but just as real and just as urgent. Obesity isn't just about eating too much. It's shaped by genes, brain chemistry, and environment. Globally, over 42% of adults are overweight or obese, and Jamaica's numbers are rising too. Obesity leads to heart disease, diabetes, and stigma. But it's not a moral failure. It's a public health crisis. People living with obesity face ridicule, discrimination, even from healthcare professionals. The media often portrays them as lazy or unlovable. But Romans 12:2 says, "Be transformed by the renewing of your mind." That means shifting how we see ourselves and how we treat others. So whether it's eating disorders or obesity, the message is clear. Compassion over judgment, support over shame, healing over hiding. Let's build a Jamaica where every person, every body, is treated with dignity, love, and hope. Thank you for watching. I'll now hand over to Akeem, who will take us through the rest of the video.
Thank you, Miss Brown and Miss Watts, for laying the foundation. So far, we have been looking at the clinical treatments of eating disorders as well as obesity, the obesity crisis worldwide. I'll be focusing on two main questions: who is most at risk for developing obesity, and treatments. Obesity, by definition, is having a BMI above 30, index of 30 and above. BMI is a screening tool used to measure your height against your body weight. Obesity is linked to increased mortality rate and other health problems. Here in Jamaica, according to the Ministry of Health survey, more than half of women and 30% of men are overweight. This means that this issue of obesity touches nearly almost every family in some way. Certain groups are more at risk for developing obesity. Black women are 50% more at risk and is influenced by genetics and the environment. Genetics means that you're more predisposed to carrying more body weight. So in our culture, we have a lot of fast food restaurants on almost every corner, and we have many social media trends like mukbang challenge, where people eat a lot of food, and this is where people celebrate eating, and so it is easier for people to live a more sedentary lifestyle. And furthermore, they're being paid to eat so much food for entertainment. As a result, people eat for entertainment and exercise becomes optional. This issue of obesity has been causing also an epidemic where people have been suffering psychologically. Let's talk about treatment. So obesity is a chronic condition and takes more than willpower. It takes lifestyle, better diet, exercise, and sometimes medication can help. Real success begins with prevention. That's where education, public policy, and awareness comes in. Living with obesity brings you under constant scrutiny, teasing, and judgment. And these things erode your self-esteem and make you more prone to depression and anxiety. When people eat for comfort, this becomes emotional eating, and this brings people in a cycle of guilt and shame. And so it's no longer a battle with a plate, but also with a mirror. I've spoken to a resident, and he has a poem to express how he feels about his condition of obesity. And so let's hear from him.
Good day, everyone. My name is Mr. Rabadaba. This is a poem I wrote some time ago. A long time ago. I can remember when junk food made me smile. Junk food was my friend, and I knew if I had a chance that I would make my fatness dance and maybe happy for a while. But fast food made me shiver with every food they deliver. Bad news on my doorstep, I can't take another step. I can't remember if I cried when I passed size 25. But something happened deep inside. The day I decided no more junk food, no more fries.
Thank you so much, Mr. Rabadaba, for that poem. So we see that obesity does not affect us only physically, but also psychologically. And so we want to look at some treatments for that. So first, the CBT method, cognitive behavioral therapy. So this is looking at how the thoughts affect our feelings and our feelings, our behavior. And so these helping professionals help you to change how you think, feel, and how you see food or you see your body, and also and ultimately your self-worth. Second, we want to encourage a supportive community that encourages rather than criticize. Thirdly, we want to encourage spirituality. So remember in 1 Corinthians 6 verse 19 to 20, the Bible tells us that our body is the temple of God. We want to take care of our body so that we can be a blessing to others and they can be a blessing to us as well. So I'm encouraging you to eat well, take care of your body, Exercise. So if you're struggling, help is available. There are many evidence-based treatments that can help you to deal with obesity and help you to start that journey towards a healthier you. Thank you for watching. Remember, the first step is the greatest step towards a healthier life. Take care.